That is always a tough question. And what my vision was then was to come in and do so much work and that it was going to be over. And that I was, going to go off and do what I thought I was going to do in the first place, which was media and communications. But what really came to mind and what really happened early on is that the fight against HIV is not just the fight against a virus, and it's not just a fight against an epidemic. It is not only an issue of health or public health. Whether we are clinicians, whether we are health educators, whether we are social justice activists, HIV actually is the magnifying glass to a myriad of social justice and human rights challenges that will not go away even if we end HIV. And so my vision now is for us to be very clear about how we locate the HIV movement, the epidemic itself, and the work to end it is actually located inside the human rights framework. And that when we can drive civil and political and economic and social and cultural equality and equity and rights and protections, then HIV, substance use, gender-based violence, homelessness, we are going to reach the end of so many issues that not only drive HIV, but actually drive suffering and drive the early deaths that don't necessarily have to happen in communities that need their people so much. What's really funny is I started SisterLove with some other folks when I was literally just out of college, and it put my grad studies on hold for a while. But it wasn't, rocket science to figure out how to develop interventions, how to have conversations with people about what your needs are. How would you resolve this? How would you go at this? What do we need to do to organize around this? And I looked up one day, trying to run a nonprofit, trying to raise funds for it, and said, you know what? We could do this because we had developed our own interventions. And we looked at what the public health arena was doing, was funding people who were developing interventions in the academic institutions and in the universities and hospitals and other places that we were doing very well and very effectively with nothing. And so I said, you know what? I need to put some theory to my practice. And so that's what drove me to get my public health degree. And it was so meaningful because we're one of the few organizations now that's directly involved in community-based participatory research in sexual health, especially for women of color. Building our capacity to do that required having some expertise and knowledge around public health and research. How this fits for me into the Act Now coalition and the work is that the beauty of our coalition is how we are intentional about bridging community and the public health field. That whether we're state AIDS directors, whether we're running nonprofit organizations, whether we're people living with HIV who are fighting for our own lives on the front line, that's what makes this coalition work. And so you have to have all of those components. Everybody has to bring something to that table. And I just happen to have this master in public health that helps contribute to that conversation. And it's a part of the bridge work that we have to do to make this successful.